Good evening and thanks for joining us. Lots of developments to get to on this Tuesday, from a new deal to test a possible vaccine here in Canada to an appeal in Quebec to wear masks in public. And there's new support for seniors struggling to make ends meet. The federal government is giving out one-time payments of up to $500 to help cover expenses. Canadians who receive old age security will get an automatic top-up of $300. Those eligible for Guaranteed Income Supplement, or GIS, will get an additional $200. About 6.7 million Canadians are expected to receive the payments. It's estimated to be worth about $2.5 billion. That money will help some, but it does nothing for the thousands of people trapped inside long-term care homes, unable to visit family, and vulnerable to the worst COVID-19 outbreaks in Canada.
COVID-19 has exposed some uncomfortable truths about our society. We've seen heartbreaking tragedies in long-term care facilities and nursing homes right across the country. And in the coming months, the federal government will be there to help the provinces find lasting solutions.
To give you a picture of how people living in long-term care have been affected, of the more than 5,100 people who have died of COVID-19 in Canada, over 80% were people living in care homes. Across the country, more than 71,000 people have now tested positive for the virus. About 20% of those cases are linked to long-term care. Long-term care homes are likely to be the last places where public health restrictions get lifted. We'll get to that in just a moment, but first, David Akin has details on the new support for Canadian seniors and whether it's enough.
For many seniors, it's about time. Seniors have been flooding MPs' offices with demands for more help.
We are hearing from seniors across the country, thousands of emails and phone calls.
But the government does not believe seniors need the same kind of help already provided to employees, students, or small business owners who have lost all of their income. Instead, the government believes seniors on a fixed income need help with higher monthly expenses.
We're announcing more help because we recognize that every week seniors are out of pocket a little bit more.
Some examples: higher drug dispensing costs because of more frequent drugstore trips, and higher transportation costs as seniors avoid the health risk on public transit and rely more on taxis and on delivery services. Meanwhile, poverty among seniors, and especially female seniors, remains a problem. The maximum old age security benefit is just over $613 a month, while the maximum guaranteed income supplement available to the lowest income seniors is just over $916 a month. That, plus a Canada Pension Plan payment, is all that more than 1.6 million seniors rely on for their total monthly income. Opposition parties are pushing the government to do more.
The help right now that they've offered is not enough, and it's also not permanent. We need to see a permanent increase in supports for seniors so they can live with dignity and respect.
And seniors advocacy groups like CARP remember that the Trudeau Liberals have yet to make good on campaign promises to boost both old age security and Canada Pension Plan benefits.
We want that to come in so they have a permanent increase in the OAS, the CPP, not the temporary 500. That's not going to help seniors in the long run.
And in the meantime, no date has yet been set when the new one-time only checks will be sent out. The government will only say that it will be within weeks. David Akin, Global News, Ottawa.
As we've said, the people most vulnerable to COVID-19 in Canada are living in long-term care homes. The problems there are long-standing and have been laid bare by this pandemic. Tonight, Mike Armstrong looks at the deadly deficiencies and the demands for change.
Even before COVID-19 hit Canada, there were warnings about what it could mean for seniors and seniors' residences. Despite that, the virus was still able to get into hundreds of residences across Canada. Patients' rights advocate Paul Brunet says in some facilities, COVID-19 spread like a brush fire because governments were asleep at the wheel.
When we woke up, the fire was already in long-term facilities. That's probably around 2 months late.
Now, Brunet is one of the people who've been sounding the alarm about long-term care facilities for years. What the crisis has done is expose the fragility of the system, and as a result, politicians now see the flaws as well.
There are serious, underlying challenges facing these facilities.
This is a tragedy.
The federal government is now promising a review of what went wrong, as are several provinces. One of the major issues many point to is labor. A recent study by a Canadian think tank calls for a heavy investment in staffing.
In terms of their numbers, in terms of their education and training, in terms of the autonomy we give them, a whole range of things.
There are also calls for more inspectors and inspections. In Quebec, there are reports this week some facilities hadn't been visited in as much as 5 years. That's actually not far off from what the current rules require.
They have to be inspected at least one time every 3 years.
One option Quebec's premier has floated is the government taking over private residences. Well, critics say that would be like nationalizing the horror stories that they hear more complaints about public facilities than private ones.
You are not even doing the right job in the public, and you want to nationalize it? I don't want that. No, no, no.
Now, the issue will be front and center Wednesday in Ottawa. The House of Commons Health Committee is holding a hearing focused specifically on long-term care facilities and seniors. Mike Armstrong, Global News, Montreal.
For the first time since the pandemic was declared, Quebec's Premier François Legault showed up at his daily press briefing wearing a mask. Legault is now strongly recommending Quebecers wear a mask when they leave home to help reduce the spread of the virus. It is not mandatory in Quebec, partly because of a supply shortage. Legault says wearing masks does not take the place of proper hand washing and physical distancing where possible.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.